everyone. I'm Nick Stanisic with Patterson Dental. I'm a territory rep here in the Tampa, Florida branch. And at a recent event, I had the pleasure of meeting Dr. Taylor Massey, a local dentist here in the Tampa Bay region. And after speaking to him for a few minutes, quickly realized just how passionate and energized he is about the Solea. I said, I need to share this passion and this energy with other dentists. So today, I welcome Dr. Taylor Massey. Thank you, Dr. Massey, for giving me the opportunity to share your experience with Solea.
Absolutely, Nick. It's a pleasure. I really do feel passionate about the product, and I've had nothing but good luck out of my Solea. My wife and I both use it in our practice, and she would say the same amount of good things about it. I know if she were here with us today, it has been nothing but a advantage in my practice. The patients have shown great affinity towards it. I know that my staff recognizes that it is a wonderful asset to have, but be it marketing, use in the practice, scheduling, efficiency, we've really gotten a lot out of having it around. And I know that it's definitely put my practice in a different place than what was before.
Awesome. Well, you're actually just leading me right into my first question. So we'll just dive right in. So tell me a little bit about your practice, a little bit of history about your practice and what your practice is like.
Yes, sir. So my wife and I purchased this particular practice almost exactly 5 years ago come September. It was owned by two men, Dr. Robson and Dr. Kiley, and they both had been in practice for 30 years. We found the practice as a result of moving from the original practice that she and I had started from scratch in Brooksville, Florida, to the Palm Harbor area. So we came in not really knowing a whole lot about what the clientele was going to be like. Turns out it's mostly 55 and older retirees. We do have some more youth coming into the practice as time has gone on, but it functions like any other fee-for-service practice does in that, most people want to focus on their insurance. And in our case, we have to offer a higher level, a higher standard of care so that we can justify the fact that we are out of network with most of the insurance companies. The style of practice that we run is general. Obviously, we do a little bit of everything, fillings, crowns, your normal bread and butter, but I do a lot of surgery as well. I do a lot of implants, including all on X cases. My wife tends to lean more towards the general practice. So we do a little bit of everything, mostly adults. Kids, we usually refer out of the practice. But one of the exciting things, we are the team dentist for the Buccaneers.
Very
that's
cool.
Something we've taken on in the last 2.5 years. So,
And you're repping your Buccaneers?
That's it. Yeah. I can't help it. The organization's been very good to me. And this is one of those that we never would have expected it, but it's obviously added some excitement to the practice. But it's also, put us in a situation where we have to show that we do offer a higher level of care, a higher level of interest in patient comfort. Because now we're seeing higher level clientele. So this was just one more area where when we decided to purchase the Solea and some other devices that we have in the office, a lot of it was motivated by the fact that we have all of these paying clients, and now we have all these high, famous clients, so we have to really set ourselves apart, and the Solea did help with that.
You have to elevate your patient experience, for sure.
Exactly.
Yeah. So that you're leading me into my next question, actually, which is about with elevating that patient experience. Why did you decide to invest in Solea?
So my initial contact with Solea was through a dinner meeting with my Patterson rep, Charlie. He had set this up. Yeah, he's a good guy. He always offers me things that he says, you might be interested in this, and he'll leave it there, right? Well, in this particular circumstance, he came into the office excited about something else, delivering some products, doing his normal rep follow-up, right? And in the hallway, he said, I've got a dinner coming up this Thursday. I think you should go. And the reason is it's a new piece of equipment that my particular dentist, speaking of his personal dentist, I took him with me in the car and told him the same thing. You need to come to dinner with me. And he told me on the way there, I'm not going to buy anything. But upon coming and seeing this technology, he took it home with him, basically that, as soon as it could be delivered to his office, and he said now he uses it every day. So I mean, I still was skeptical. I told my wife, hey, I'm going to go to this dinner. I'm going to get some free sushi, and do you want to come? We couldn't get a babysitter, so I went by myself. And then I get there, and doctor from Orlando was presenting based upon his years of experience with lasers and the difference in Solea versus the other ones on the market. And based, I instantly could see the difference in what this device offered over the diode that we had at the time in the office in particular. But compared to other CO2s that we had used in the past, things that I had used back in dental school 12 years ago, anything that I had seen advertised, whether it be, just stuff on the internet or something that I had seen that someone had showed me in the office. And the emphasis for me, and what really had me sitting and being the last person at the dinner talking to the Solea representative, was the fact that it seemed so useful in so many different aspects of a practice. So, and then on top of that, here we are.
You're going to get into that later, so that's great.
Yeah, yeah. And I just say, there was all these buzzwords, of course, but the main thing was, to me, it seemed like I'm now going to be offering something that my patients deserve to have me offer in my practice. And I was instantly in love with the idea of having it. So that's kind of how I made the choice to get. Dan at the time was the representative. He came to the office, I think 3 days later, and we signed paperwork. And this was before the first of the year. So we had it in our office by February.
Well, so that leads me to my next question, was when did you purchase this? So you started with in February of 2025?
Yes. Yeah. Started in February 2025. That was when the install happened. And as well, we had our initial training that we did up in Denver. And once that was done, we were able to start using it on patients very soon afterwards. And of course, Solea has a program that really ramps you up quickly in your ability to use it. And they try to get you to not be scared of using the product, as well as, quickly increase your efficiency and proficiency with the device.
Are you using it right now?
I use it every single day, and that's not an exaggeration. I mean, I don't even have to find reasons to use it, I'll be honest, because I usually just have it sitting between two rooms. We have an open bay style office, and so the back of the operatories has an open wall. The front is where I enter behind the patient, right? So we just will roll it between two of them, just so that I never really have to go without it. The problem is my wife usually practices on the other end of the hallway. So
You got her fighting after it?
that's right. She'll come down to where we work, just so we don't have to roll it all the way down the hallway. But yeah, it's used every single day. I would imagine at least 3-4 times a morning, 3 or 4 times an afternoon. And I use it in so many procedures. I have found an application for it regardless of how invasive or non-invasive the procedure is. And it just has so many applications.
Me right now into the clinical impact, which is our next area I want to talk about. So perfect segue. So how has the Solea changed the way you're treating your patients on a daily basis?
So I have many more conversations that I can have with patients about options for their treatment. And I know that, for instance, I had a very difficult crown prep in number 31. So this is, yeah, right. So I'm back there looking and working against the ramus. I know that I'm going to have to do some crown lengthening, but it's going to be a bloody mess, and the tongue's going to be in the way and all this stuff, right? So I have my 10 times magnification loops. I'm back there examining the area. I know that I should be able to get a margin, but to begin this treatment, I had a guarded prognosis that I had discussed with this patient. And she's not somebody who really likes to spend money on something until she absolutely has to. So there we were. I was able to use the laser to retract the tissue and take some of the tissue down on the ramus side of the preparation. No blood at my working field. I knew that I was able to place that margin deep enough where I was going to have plenty of ferrule for the prep. I was able to examine every surface. I knew that I wasn't going to have to worry about cutting the tongue, cutting the cheek, because that laser beam is so controllable. And, with adequate, another thing that's underrated with the device is the mist versus what we're used to with handpieces. It's such a fine coating of the water that it doesn't really interfere with your ability to see. And since you're cutting visually anyway, it's very important that would be something that is able to provide. But I find that it's even easier to work in an area like that where you have limited visibility. And I know without a shadow of a doubt that the level of treatment that I was able to provide in this particular circumstance, and there's so many others, wouldn't have been possible had I have not had access to the Solea. So I think on a daily basis, what it has allowed me to do is provide a higher level of care. It allows me to discuss things with patients who are scared, whether that be of the sound of the handpiece, because this doesn't make that same sound, not those same vibrations. It also allows me to work more quickly with someone who really doesn't want to sit there that long. I can have that discussion about, the big buzzword is using no anesthesia for filling.
Yeah.
Well, obviously I've done that many times. That's, a once a day thing. But I'll be honest, that part of it is wonderful. It gives me one more thing to talk to a patient about comfort. But, for years, I prided myself on being able to have that wonderful dentist handshake. That is the ability to give an injection without pain, right? So
Yeah.
that was not something I was necessarily scared of anymore, but
Yeah.
that it's just one more layer of stuff that you can provide the patient of. Here is my emphasis in my practice of, I want you to be comfortable and I want you to know I'm going to do the best job possible, and you're going to get that treatment and you're going to enjoy getting that treatment. And that's why I feel like my patients come back. So it fits into that so well.
Awesome. That makes sense. So you started talking a little bit about the procedures there, and you were talking about number 31 there and the crown prep. Can you talk a little bit about other procedures that you're using the Solea for?
Yeah. So like I said, I really will kind of use it regardless of fillings. We will deep class 2 preparations, doing that little bit of gingival retraction at the bottom of the prep, as well as prepping the entire surface at the same time. Crown preparations, I'm using it for crown lengthening, tissue management, and I have scanners in my office for my restorations as well. So having that ability to trough without bleeding, without something like a diode where it leaves that nice hamburger meat style tissue at the margin, right? And the little burns that happen. This doesn't do that. So the cleanliness of prep, the tissue procedures, frenectomies, operculectomies, I do those with topical anesthesia, regardless of age. My pre-preparations for Invisalign, if I need to close the diastema, something that's often overlooked is treating the frenum, the labial frenum, and making sure that we don't have scar tissue between that diastema. Well, this is just one more thing that makes that procedure so much easier. We've done tongue tie. I've done other gingival procedures, including preparation for laying flaps for coronal advancement flap and gingival recovery over root surfaces, tissue removal over implants, sterilization of sockets during bone grafting and extractions. I'm making sure that my bone graft is going to set correctly and in the way that I want it to at the base of the socket. Like I said, I mean, I could go on and on and on, but I think that
To everything.
everything. Yeah. And the one of the most amazing ones is I had a 12-year-old who needed a canine. It was a bony impaction above the deciduous canine. The orthodontist had sent her to me. He was one that I worked with when I was still in Spring Hill. I was able to not only remove the tissue over the top, and then normally I would have taken a handpiece and ground the bone away and made sure I stayed off of the tooth and tried to give him a good working field to place our gold chain. But here I was able to reach for one instrument. I was able to reach for the Solea, go through the tissue using my CT scan to triangulate where the tooth was, place the shape, draw the outline of where the tooth was supposed to be, and go all the way through the bone to the tooth, knowing that when I got to the tooth structure, the behavior of the laser was going to be completely different. It was going to spark more, which, the doctors that use this will learn about the plume and the different ways that it behaves. But since you're cutting visually, that part's a little scary to begin with, but then you start to appreciate that. And in this particular procedure, the cleanliness, the fact that I was able to send her 45 minutes up the road, knowing she wasn't going to bleed, and knowing that when she got into the orthodontist chair, he was going to be able to bond that bracket immediately and then place the gold chain, and she was going to go off into the sunset and not have any problems. I mean, and she's 12 years old. She's scared to death.
Yeah.
Yeah, it's awesome. So, like I said, I use it for everything, and I find something new every day that it really can be applicable for.
One of my questions was about a patient story, but maybe you have another patient story, but that was amazing. But have you noticed differences in patient outcomes or case acceptance since you started using the Solea?
Yes. So case acceptance, I will say, is harder to quantify. I know that if I have someone who is terrified, and here's another patient story. I had a 16-year-old, which, we get jaded over time, right? You've done this for a long time. You get tired of hearing the same things of, well, another kid that's scared, or another adult
Yeah.
that's scared, or you've got that 45-year-old guy with a big, thick mustache and tattoos, but yet he won't sit there for a procedure.
Yeah.
So you try not to judge anyone. You try not to become jaded, right?
Yeah.
But there's a 16-year-old girl, and, you could tell by talking to her, she had had some pretty horrible experiences in the past. Well, she brought mom day of procedure, and I was going to do two kissing lesions, right? I was going to do a 4 and 5, a class 2s adjacent to each other, one DO, one M, right? So I had told her, look, there's a chance, and I know this sounds crazy, we won't even have to get you numb for the procedure. And this was at the intake appointment, right? So she looks at me like I've got a horn growing out of the middle of my head, right? But, mom had mentioned it to them on the phone when they were confirming the appointment with the front desk, right? And she said, he said something about not having to give her a needle. And they said, "Yo, yeah, he's looked at these. He knows that they're very shallow. This is kind of more on the, yeah, they need to be done, but it's preventative still because they're very lightly into the dentin. So, he really shouldn't have to give her any medication." And so they came in. She was there ready to hold her hand. Girl sits down in the chair, and I said, "Look, you tell me at any point." I always have this one joke, and my assistants, just like other assistants, get tired of hearing me say the same one-liners, right? But I always say, listen, you're not my prisoner, you're my guest. So if you ever decide you want to get up, that's your thing. And I mean,
I like that.
in the sense of, because I'm not in the business of torture. So,
Yeah.
but, here she is sitting there, scared to death, Solea handpiece into the mouth. We've done our talking, we're ready to go. And she sat there super calm. You could see the hands on the gripping the chair, right? Release. They knew that she was no longer going to feel it. And that whole procedure from start to finish was
Wow.
completely different than any other types of procedures would go that way in the past. The moment you get out the handpiece, the moment they hear that sound of you priming the water and it's beside them and they're still hearing that,
Yeah.
that's enough to send people sometimes out of the chair. So
Yeah.
this was one of those cases that I was able to win because of Solea.
Wow. That's a great story.
Yeah,
Yeah.
yeah.
My next question actually was, do you have a favorite patient story? Is that your favorite
I think
patient
that's
story?
mine.
Yeah.
Yeah, I really do. And it just illustrates so much about it, not only how useful it is, but you say patient acceptance. I really don't think that girl would have come back, had it have not been for us being able to offer her something different. So it's been life-changing, and I think if you still care, you've done this long enough that you forget that person that was in dental school that said, I'm going to go out and I'm going to change the world. And I hope that all of us were there at some point. I know that I was. But there's not a whole lot you can do to change the world with teeth until you find out that how many people have either, I won't call it mistreated, but
Yeah.
they have had bad experiences,
Experiences. Yeah.
Yeah, and if you're still passionate about finding ways to communicate with people and give them a better opportunity to want to take better care of themselves, but that first step is fixing the things that are wrong. This is a very encouraging aspect of our practice that we can look for and say, hey, we've got one more tool that we can use to change that narrative, and that's a big deal.
Well, you just answered my whole next question, which is really about anxiety and discomfort. And so it sounds like this has really just eliminated a lot of that. I'm sure there's still some that's normal, but I'm impressed of it.
Yeah, and I think that the hardest part is, and I think I talked to you directly when I met you about this. It's kind of funny the way that Solea teaches, and I still understand why they teach it this way, which is have a discussion with the patient that they're going to feel cold, and it could feel something like as cold as biting into an ice cream cone, and it being that painful. The same feeling that I get just saying that out loud. Here I have worked on my interview with the patient and my intro with the patient for years. And the difference in dentists now is we have a lot more communication classes and stuff in school. Well, that's not entirely why you develop something like this. You have to develop the way you want to do it, right? Well, now you've got a company that you're going to use their device and they're telling you, here's how I want you to introduce this to a patient. So that's already a little bit weird. But that conversation about, hey, you might feel this. I've changed it over time. I've now developed a different look at that where, some people feel it, some people don't. The beauty of this is I get to change my conversation where it used to be, hey, we're going to get you numb, we're going to get started.
Yeah.
Well, you start with that topical entry. The patient knows that needle's coming around their head. They're looking everywhere for it. But that never happens, And there are times where it can be that you still have to administer anesthesia, but you kind of know that before you get started. You've still got those same patients that are going to be a little more difficult. And I joke it, but I mean it. I'm not in the business of torture. So I would much rather alleviate that anxiety before we even get going.
100%.
But another thing that's kind of funny is that, and this is something the doctors will learn too, is that it does a great job of cutting tooth and tissue. But when you go to polish your restoration at the end, you're still going to reach for that handpiece. That's just not something that it's very well suited for.
Not made for that.
Well, it's not made for that, right? So, and that's not its fault. That's just not what it does. So I will still grab and listen. Like I said, I've based my practice to be as comfortable as possible. So I have electric handpieces, and as doctors will know, there's less vibration, less noise, but they still make a racket. So I go to get that 20 or 30 fluted burr to polish my restoration, and the patient hears that sound of that thing warm up and get it near the tooth, and they're immediately reminded why this other is so pleasant. So we cut the whole tooth with Solea, regardless if they were numb or not. They didn't have to experience that vibration, that sound, and all the other things that they associate why they don't like the dentist. And that's huge. So,
why they don't like the dentist.
Yes, right. And we get to fix a lot of that. So Solea, for that reason, is wonderful.
Well, that's awesome. You actually just let me into another, I want to segue into like your business and practice growth and that area of your practice. So how has Solea played a role in like scheduling, production, efficiency? You can just be generic with this. You don't need to get into details, but
yeah. So scheduling is something that's very easy to quantify. The same day treatment, when you have a person sitting in the chair, the business side of dentistry, people have been told for years, if you can do it the day the patient's there, that eliminates chair turnover in some circumstances. So say you are somebody who likes to roll Solea into your hygiene room. I don't do that. I still keep it in my treatment rooms just because everything's in there. But you could do that if you wanted. But if you don't have the patient leaving and then hoping that they'll come back, some people get busy. So that adds to what that you're going to collect, right? So if we're talking strictly collections and business, that's a good aspect of it. Same day treatment's more available because you don't have to get the patients numb in a lot of circumstances. I also have seen an increase in the amount of procedures that I am not only doing, but comfortable doing, right? So, some of the reasons that dentists will choose not to do certain procedures is, well, there's too much blood, or it's hard to manage that flap, or it's hard to manage that tissue. Well, that's something that Solea definitely helped with when it comes to tissue management and adhesion management. And then when it comes to the quickness with which I can complete a procedure, I take 15, 20 minutes off sometimes of waiting for numbing to set in on, say, a lower molar, right? So that's a huge aspect of how the practice has become more efficient. Adding procedures is definitely something you can correlate to the business increases. So the Solea Sleep, the Peria Guide, and those are, obviously more detailed answers, but those are two specific procedures that Solea offers that I have had patients come in, especially with the sleep, that had asked for many other options from other dentists. And here they are in my office, cold call, right? Showing up, asking for me to do the Solea Sleep. And that's $250 for 15 minutes of my time. So, I know for sure that it has added money to the practice.
Are you marketing that Solea Sleep out there right now?
We are basically through our website. And then Solea, once you are a provider, adds you to their website. So you have that marketing avenue as well. And I think that's how the majority of the patients that have been, I know it's not cold call is the correct term, but off the street, right? That cold called us, right? So that's been through Solea's website and their research into, hey, is there anything I can do for my snoring?
Yeah.
and they've tried everything. And for a couple of these cases that have recently come in, I can think of one lady who she said it was like an off switch. She went from snoring every night and her husband complaining to now she doesn't snore at all. So it's something
It's awesome.
incredibly
That's
exciting.
amazing.
Yeah.
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 That's a life-changing experience for 15
Like,
minutes of time,
yeah,
right? Yeah.
15 minutes of time, man. It has nothing to do with the teeth. So,
Yeah.
it's like,
Yeah. Wow. Okay. So we were talking about production and some other things there. I know this isn't something that every dentist digs into, but ROI can be important, your return on your investment. So if you could, quantify that ROI, financial or otherwise, or however, how would you describe or quantify that ROI?
so my payment on the machine is something like $2,100 a month, right? So I finance the entire thing through Patterson. I'll just be honest about that, right? So it takes me, if I charge $250 a sleep treatment, for instance, and that's 15 minutes of my time, like we talked about, I could do 10 sleep. That's very easy to do in a month, right?
Yeah.
I could do one more filling a day that I'm
Yeah.
not providing otherwise because I didn't have time for it. And I have already made around $5,000 with just that extra filling a day. Oh, and this is coming from someone who is fee for service, right? So, my cheapest filling that I do is $270, I think, for a class one. So I know some dentists are going to throw up with what they're able to charge, but that's the way it is around here. So, but even for a dentist that is practicing, seeing every HMO, PPO, and having to argue with every insurance company, they still, you're talking about doubling, tripling your efficiency in a lot of circumstances with your fillings. If we just focus on one procedure.
Just on fillings. Yeah.
Yeah, yeah. So, and then, some dentists, I know that when I was in a more insurance-driven practice, there's creative ways that they'll try to charge certain things for crown lengthening and all that. Well, okay, with as much as I charge for a crown, I don't charge my patient for crown lengthening. Okay, so, I just do it as part of it because I need to so I can scan it and then do the same day crown, right? Well, if you're in a practice that's doing more PPO, HMO, you add that crown lengthening procedure, that's a $300-$400 procedure, that you weren't charging before just to go with your crowns. And if you're doing on average, I think most people do between 15 and 30 crowns a month, depending upon which practice you talk to, that's easy, right?
Yeah.
You're adding 10, and you're charging, that's $4,000.
Yeah. So it pays for
It's
itself.
instantaneous. Yeah, it pays for itself early in the, this is not one of those things you're waiting and hoping to work on Fridays just to pay for. So, and that's kind of how I look at it. We didn't really have to think twice about how it was going to fit into our practice. And two, with the cost overall, and I look at this maybe a little differently than most dentists do, but I bleed money constantly, right? And I know that I'm going to be buying new things and new technologies. So I see it as an asset. And when I originally depreciated and now with the new depreciation laws with taxes, you're instantaneously depreciating that device. It's a huge tax incentive. I mean, here we are at Q4 and, I'm finding new things to spend money on to help with tax incentives and everything
Yeah.
like that. But this was last year. So, and it helped us to make sure our basis was correct and everything like that, my CPA. So I think it fits well into everyone's, finances as long as you're, pretty solvent with the way everything is working in your practice. But it's very easy procedure by procedure to just see immediately how it's going to pay for itself.
It sounds like to me too, even just like that patient that comes in that maybe is a quick filling that they were going to leave, but you have an extra 30 minutes in your schedule and you could
Right.
do that, right? And you add that production and you do that once a day even,
Yes.
that alone could just pay for it. Like,
Once a week, really. I mean,
yeah,
yeah, think about that too. Because if you're only looking at something as a $2,100 payment and your goal is to add one procedure a week, that mindset permeates into the way that you do other things. That's that, if I don't have to stress about doing this procedure for lunch, but I'm still going to get to eat. Well, sure, you're going to do it, and that's a lot of the way that this fits into my practice is that type of efficiency, that type of
yeah.
ease of use.
Awesome. Okay. So what would you say to like a dentist right now that's on the fence? Maybe they're thinking about Solea and they're like, wait, this costs a lot of money. This 6-figure cost here. Can I do this? Can I really make this work in my practice? I don't know. What do you say to somebody like that?
I have a variety of different friends and colleagues in the industry. Everybody approaches that type of purchase a little bit different. And so I've tried to, in this answer, consider everything that they're thinking of. I know in my circumstance, I was able to easily justify it because if you think about the other things that I have invested in, I have the Prime Scan, I have Prime Mill, I do the whole entire CEREC ecosystem.
Day dentistry. Yeah. Okay.
Same day dentistry, right? So, and then I have LED array lights for my patients. I have TVs hanging above every patient. I've invested money so
That's been a
many
little
other
bit.
places.
Yeah. Yeah.
Yeah. And so if you look at it as a one-time purchase in and of itself, well, yeah, sure, it's a lot of money. I tend to look at things as a monthly payment. And in my circumstance, that $2,100 payment fits well into my budget because we on average are doing about $150,000, $160,000 a month. But my emphasis is on the equipment that I use, the ease of use, how stressed I am to go through a day, right? And if that $2,100 payment is easily paying for itself, one, but two, I find that I'm either more comfortable and less stressed by the end of the day and that my patient interactions are better, that's an easy payment for me to justify.
Yeah.
Now, what I've heard from some of my colleagues is, well, they don't look at things like monthly payments. And that's dependent a lot on age. I think that younger doctors are going to be like, oh, well, I have so many monthly payments. This isn't that big of a deal to think of it that way, right? Because we just have debt for everything. But if you have an older patient who's already fully invested in the practice, they're not making business loan payments anymore. They're looking for the fact that they can just dump a bunch into retirement, be ready to sell their practice when it's done. Well, then you're talking about an investment into the practice that if you're not planning on selling to corporate, maybe, and looking for a doctor to come in that can be excited about being with you in that practice, well, this is an entire treatment modality that nobody really has access to when they come in out of school or from another practice that they might not have ever seen before. It's a very attractive thing offered to that doctor. So, I think there's many ways to justify it. It was easy for me to do. It may not be so easy for everybody else, but I think this is our biggest replacement. Based the same as saying, and I told you this when we met the other day, right? Which was the difference in scanners versus inserting an impression into someone's mouth. How big that felt that day when you realized there was a better way to do it.
Yeah.
This is like setting your handpiece in one hand and setting Solea in the other and having that same differentiation. There's a better way of doing it, right? And we haven't ever thought that we were going to do that with the drill, right? I mean, that was
The handpiece was like, no one ever thought like the handpiece is going to go away, right?
Right.
Yeah.
And it's not completely, of course, gone away like we talked about earlier, but it's losing a lot of ground in my practice because I just don't reach for it as often. So that's huge.
Awesome. Okay. Well, last question, and then we'll just finish this up here. So what excites you the most about the future of your practice using Solea?
I think that the ability for me to offer that comfort, that change that people have not seen before is the most exciting part of it. And I know that through the other things you and I have talked about, I'm going to be doing a little bit of just reiterating that. But I can tell you without a shadow of a doubt that sitting with that patient for the first time and knowing that I'm going to be showing them some things and doing treatments in a way that they've never seen, but that are going to be so much better for the outcome and so much better for their psyche even entering into the treatment is perhaps the most exciting thing that's happened in my practice since we've had either one of the practices that we've started. I've not been in for 12 years, is how long I've been seeing patients, the last 2 years of school included, right? So I haven't been doing it as long as a lot of people have, but it's based in that same way. The excitement that I have is that much more real because we've seen so many changes in dentistry just in the last 10 years. Who knew that we were going to be seeing something like this that could provide this level of change to the interaction with the patient? And that is the same way I felt about when somebody showed me a scanner that worked. Okay, because I used the ones that had the aluminum spray you had to do in the mouth and all that. So I've seen them come along the way too.
Yeah,
but
for sure.
That replacement for the impression, like I said, to the scanner, but that interaction that I'm able to have with patients, the difference between the handpiece and now the laser, and just how easy I'm able to complete procedures and the level of care that I'm able to provide is so exciting.
Awesome.
And I see NFL players on a daily basis, and some of them have never seen the dentist before. Some of them have been going to these highfalutin dentists for years, and I still have one thing that I can offer that I know there's like a 99% chance that they've never seen something like it before. So
For sure.
it's a big deal for us.
Game
It's a big
changer.
deal for my wife. It's a game changer, and there's just no other way to put it. So
Awesome. Well, is there any last thoughts that you have before we end this that you'd like to just say to other dentists that are thinking about this or anything, any last little points?
yeah, I mean, I think that if you're on the fence about it, I honestly am willing to talk to anybody, and Solea
I
has
appreciate it.
on.
You did this so thank you.
Yeah, I think that it's a hard sell for some people in the sense that they just never had any experience. And I'm just another face on the internet, right? So until you talk to me in person, you may not believe anything I'm saying. But I mean, people can come to my office and look at it, see it being used. I don't mind. I just know that the videos are real. This is one of those things that the problem
Yeah.
with Solea, I feel like it has, is it's trying to undo years of lasers not doing what they said they could provide, right? And
Yeah.
and that's a big thing to overcome. But I can tell beyond a shadow of a doubt, it does everything that I ever hoped it would and more. So if that's the last hang up, don't let that be the hang up. It really does do everything it advertises. The ease of use is there. The cost and cost per, what you get out of it. I think it's easy to justify the cost. And, I can tell you that any of the patients that I have that you can talk to, and see just from my reviews, Massey Dentistry is my practice. There's people who have mentioned that procedure in our reviews online just because they've never seen anything like it before. And that's huge. The word of mouth from that, I could go on and on, but I really think if that's the last hang up, there's so many reasons to overcome that and take the dive because it's worth it.
Okay. Well, I'm going to actually be ending this here with something about the Solea Immersion experience. So I'm going to be talking about that. But before I get into that, I just wanted to say thank you. I appreciate you joining me. I appreciate you taking time out of your day. And you've been wonderful. And this has been awesome. And I hope that this is a great asset to every dentist out there that's watching this and that they can gather some good information from this interview. So again, thank you.
Absolutely, man. No problem at all. I'm happy to do.
I appreciate it. Have a great day.
You too, buddy. Thank you.
Before we finish up, I did want to mention an event coming up in Austin, Texas on October 9th through 11th. This is called the Solea Immersion Experience or the Solea Summit. This is a wonderful opportunity. If you can see on the screen, it has details there. I am going to have a link down below, so you can go ahead and click on that and you can see all the details here. It is $695. That covers your CE, your stay at the Austin Marriott Downtown Hotel for Thursday and Friday. That also covers your meals. So again, this is a wonderful opportunity for you to go be around like-minded dentists. There's going to be other Solea owners there, so you're going to be able to talk to them, get their feedback and what they're doing with the Solea. And it's only $695. You just have to basically get yourself there. If you go to this website, you'll be able to see the agenda here. You'll see video from last year, other information, some videos. So I highly recommend if you're even considering Solea, this is a wonderful opportunity to go to the Immersion experience and learn more about it. If you have any questions, please contact your Patterson Dental rep and they can give you more details. And you can also click on the link below. Thank you very much.